So week 5 post-mastectomy has been full of appointments and blood work and CTs, all that fun stuff. I had mentioned last week I had a problem with my knee. It got worse because I overdid it, and then it got better because I rested it. But in resting my knee and in favoring the good leg, I had some problems with my low back this week, which is actually the reason I started yoga, is to build up core strength and to manage low back pain. So this week's practice is really good for the low back. If you have acute pain, not everything is appropriate, and the exercises should not cause pain. If it hurts, please stop. Otherwise, just see how it feels and enjoy. So we'll start on our hands and knees, and it's really nice to have a blanket or a towel under your knees. If you have problems with your wrists, it's great to have a second blanket or towel under your wrists as well, and then you would place your wrist at the very edge of the blanket and have the fingers on the mat, especially pressing into the index finger and the thumb and making sure that this part of the hand is firmly on the ground. When we lift that part, then we get a lot of strain on the outer edge of the wrist. So this would be a nice way to keep the wrists safe in this practice with a second blanket. Knees are about hip distance apart. I like to have the tops of the feet on the ground. If it's more comfortable to have your toes, go ahead. And really spread through the fingers. You can have the hands directly under the shoulders, or you can have them just a little bit forward, whatever works for you. And we're going to take our awareness to the breath, deep inhalation and exhalation, and then start moving with the breath, tilting the pelvis. Inhale, tilt the pelvis back. Exhale, tilt the pelvis forward. Inhale, back. Exhale, forward. So it's a small movement. It's not cat-cow yet. And move with your breath. Be aware what's going on as you tilt the pelvis, where you feel it. Just a couple more. Inhale and exhale. Inhale and exhale. Bring your pelvis back to neutral and shift the hips from side to side, left to right, right to left. Take your neck along if that feels good. Okay, and now we'll move through cat-cow. Inhale, tilt the pelvis, take the chest between the hands, and exhale, draw the navel up, look down, arch the spine. Inhale, lengthening, and exhale, rounding. Inhale, cow. Exhale, cat. 2 more. Inhale. Exhale. Inhale. And exhale. Come back to a neutral spine. Turn your hands so that the fingers are facing the outside edges of the mat, and shift a little bit from side to side here. And if it feels good, move the neck, move the hips as well. Okay, back to center. Take the right hand behind your head, bending the elbow. Inhale, twist to the right, and exhale, round it down, twist to the left. Inhale, opening up, twisting to the right. Exhale, rounding down, twisting to the left. Inhale, elbow up. Exhale, down. 2 more. Inhale up. And exhale, down. Last one. Inhale. And exhale. This time, straighten your arm as you inhale. And as you exhale, take that arm underneath the left. Bring the shoulder to the ground. Bring the right ear to the ground. If the right ear doesn't comfortably come to the ground, you can place a pillow or a block under your head. Oh, and just get that gorgeous stretch, that gorgeous twist in the back here. Keep both feet equally on the ground here. The tendency is for the right one to lift. And you can use the left arm to just press yourself a little bit deeper into the twist. Breathe here. Relax. And slowly make our way out of that. Come to the other side. Left arm behind the back. Inhale, open up to the left. Wow, that really stretches. Exhale, round it down. Inhale, twisting to the left, and exhale, twisting to the right. Inhale, up. Exhale, down. 2 more. Inhale, and exhale. Last one. Inhale and exhale. And then inhale, take the arm out and exhale. Reach that left arm under the right. Take the left shoulder to the ground and enjoy the twist on this side. Let your breath flow deeply. Slowly make your way out of the twist. Back to all fours. Stretch out the left leg and rock it back and forth a little bit. And cross the left leg, still straightened over the right. Look over the right shoulder and send the hips a little bit to the left. Keep the abdomen lifted here so we're not sinking down, but nice and lifted, and enjoy this curve in the back. Length through the whole left side body. Come back through center and take that left leg over to the left and come on up. Turn around so you can see me better. So the toes are pointing forward. We're on the right knee. So inhale. Inhale the right arm up. And just reach over, getting that wonderful stretch. Always breathing into it. Come back through center. Take your left ear to the left shoulder. If you like, you can just place the left arm on there. Reach the right arm out and bend the wrist, sending the fingertips back, sending the fingertips forward, back and forward, back, forward, a couple times. Do it faster or slower, depending on what feels good for you. And release. Come back to all fours. We'll take that on the other side now. So stretching out the right leg. Rocking the right leg back and forth a moment. And crossing the right leg over the left. Looking over the left shoulder. Shift the hips a little bit towards the right. And again, make sure you're not sinking down here through the core, through the middle. Keep the belly lifted. And breathe. Breathe length into the right side body. Moving back through center. Send that right leg out. Again, I'm going to just change around so you can see me better. And this time we'll inhale the left arm up. Stretch out through the left side body. Still dealing with cording issues, and the mobility is just not at 100%, but feels good to stretch. And release the left arm back down. Take the right ear towards the right shoulder. If you like, use your hand just for a little bit of extra weight, but without pressure. Reach the left arm out and point the fingertips back and forth at your own pace here. With your right foot, make sure that the outer edge of the right foot remains on the ground. There's a lift in the right ankle. A couple more times with your hand. And release. Come back to all fours. Engage the core by engaging the pelvic floor and the abdomen. Stretch the left leg out, and from the left thigh, keeping the hips even, lift the left leg. Now just notice what's going on with the hips, that we're not lifting the left hip too high. And then we're going to pulse up. The left heel comes up, 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 up. Another 5, 4, 3, 2, 1. And we'll hold the left leg there. Keep the core strong. Keep the hips even and reach the right arm forward. So this is a really great way to build core strength, which really helps with back pain. But again, this isn't an exercise to do when you have acute back pain. It's more preventative. Just breathe here. Feel how strong you are. If you're a little bit wobbly, no problem. And release your hand, release your knee. Notice the difference between the left and the right side body. And then let's take it over to the other side. Stretching out the right leg, engaging the pelvic floor, engaging the abdomen. Mula Bandha, Uddiyana Bandha. Lift the right leg from the thigh. And let's bring that heel up, 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 up. Another 5, 4, 3, 2, 1. Let's hold the leg there And reach out the left arm. Breathe here. Keep the abdomen lifted. Keep the whole core engaged. Relax the tongue, relax the forehead. One more breath. And release the hand. Release the knee. Turn your hands so that the fingertips are facing the knees and rock back and forth a little bit. Only as much as feels good. And then flip the wrists so that the palms are facing up, but the fingers are still pointing to the knees. And here also you can rock back and forth a little bit. Like to really move back. Nice, and then just sit back, shake out the wrists, circle the wrists, whatever feels good for you. And then we'll come down and lie down on our side. So lying on the side with the head resting on the right arm, left arm supports the body, the knees are bent. We're going to bring the top knee up and then straighten the leg and kick it back a little bit. Let's inhale, pull it up, and exhale, straighten, send it back. Inhale, bend the knee, pull it up. Exhale, straighten, send it back. Keep it going with your breath. And this is good. I find it good even when my back pain is acute. It just mobilizes the area without putting any pressure on it. We're going to do 4 more. Inhale and exhale. Inhale and exhale. Inhale and exhale. And last one. Okay, and then let's change sides. Blanket's a little bit in the way, but I still want it later. Still feels strange to lay on my left side where the surgery was. Okay, and inhale, draw the top knee up, exhale, straighten the leg, send it back. Inhale and exhale. Inhale and exhale. Bend the knee, straighten the leg, send it back past the midpoint. Another 5, 4, 3, 2, and last one. Inhale and exhale and release. Nice. We'll come on to our back now. You can also use your blanket, lie on your back if you like. Take the soles of the feet together. Let the knees open up. Of course, if that's not comfortable for you, Then you can straighten the legs or you can take the knees together. Take the arms out to the side. And inhale, raise the arms, keep the shoulders low, and exhale, lower the arms again. Inhale, and exhale. The chin is slightly tucked towards the chest, lengthen the neck. Inhale, arms up. Exhale, back down. We'll do another 7 of these, mobilizing the shoulders. This is also good for if you're doing radiation in that area to avoid a frozen shoulder. Another 5. Actually lost count, but 1 or 2 more or less isn't a problem. 4, 3, 2, and last one. Okay, place the arms where they're comfortable. Bring the knees together and take the feet as wide as your mat apart. And drop the knees to the left. Drop the knees to the right. Windshield wiper the legs here. Move at your own pace. Again, this can be done quicker, it can be done slower, whatever you like. And the next time your knees drop to the left, drop them all the way and turn your head to the right. Just hold it here and breathe. Come back to your center, we'll switch sides. Knees over to the right, head turns to the left. Deep breaths. And come back through center. We'll take it to happy baby. Grasping the ankles or the big toes or the outer edges of the feet. Arms between the legs. The tailbone pointed down to the bottom of the mat. So not rolling up. And try to work those thighs towards the ground. Soles of the feet are facing the ceiling. And go ahead and make whatever movements feel right in your happy baby. Be stretching out one leg and then stretching out the other. Maybe rocking from side to side. And release that. Come onto your back. Find a comfortable position for Shavasana. Close your eyes. Relax the feet, the legs, the pelvis and hips. Relax the abdomen and chest. Relax the low back, mid back, upper back, the shoulders, arms, and hands. Relax the throat and neck. Relax the head and face, the jaw and tongue, eyes and forehead. The body is completely relaxed. The mind is calm. Allow the breath to flow, every breath helping you sink deeper into your relaxation. Bring movement into the fingers and toes. Circle out the wrists and ankles. Stretch and sigh. And make your way up to a comfortable seated position. And we'll end together with the Sanskrit word for peace, shanti. Deep inhalation. Om Shanti Shanti Shanti. Om, peace in our thoughts, peace in our words, peace in our hearts. Namaste. Thank you for joining me. Have a wonderful week.